Hi, my name's Leo, the co-founder of the Brisbane Spine Clinic. The patients that I see are usually younger population of the lower back clients, ranging from elite athletes to casual gym goers.
Hi, my name is Justin. I'm the co-founder of the Brisbane Spine Clinic. My specialty is in helping patients getting a second alternative option to spinal surgery and also helping patients who has tried surgery but hasn't had a successful outcome.
Hello, I'm Caroline. I'm the spinal consultant of the Brisbane Spine Clinic. I actually specialize in women's health, and I see a lot of female patients who suffer from a lot of back pain during pregnancy.
Yeah, usually the patients that I see, the younger population, those professional athletes, they suffer from either muscle imbalance, which is causing a lot of distress into their spine. And I've come across many gymnasts and many lifters that actually has really poor control of their pelvis, which also has an impact on their lower back pain. And I'm sure you guys have come across anything like that for older and female populations as well.
Yeah. The patients that I see, I find a lot of times in order to unlock or in order to unravel and get it out of the chronic back pain is to identify what they're actually doing, how their body is moving. So a lot of that motor control pattern sometimes is really, really off, and that's why it's led to patient developing movement patterns that's building up strength a lot more in certain areas. The interesting thing is a lot of different structures can actually mimic themselves as sciatica or back pain. So I'll just take a few examples. So a lot of patients that we see that suffer, say, leg numbness or even leg pain, a lot of times it's just issues in the hip flexors, or a lot of times it's issues in the abdominal muscles, which when it's dysfunctional can mimic back pain and sciatica symptoms. So at the end of the day, the problem might not actually be in the spine.
Yeah, and also I've also had a younger patient who's a professional golfer. And he's been getting, he called it a sciatica of the right leg, and it was in fact a piriformis syndrome. And for that, those golfers do have to do a lot of unilateral, let's say, exercises and twisting and rotations, which puts a lot of pressure into certain muscles. And it ended up being a piriformis syndrome. And and it wasn't.
And I guess a lot of the times when we start to look above and beyond where they're actually experiencing the pain. So going back to your golfers, there's some that I've seen, they started to develop a lot of excessive rotational strain in the abdominal area, in the lower back and the hip. Some of them can be as simple as because the thorax, the chest is stiff. So they can't drive rotations through there, and they start to overuse and driving rotations to the lower joints. And that's something that we have to fix up as an underlying issue. And sometimes these little things that keeps on making them experiencing the recurrent pain.
And also some female patients that I cover here are actually having a lot of weakness in the pelvic floor muscles, and they end up with a lot of symptoms such as incontinence and leakages and pain with a lot of bending, and especially women within the pregnancy end up with a lot of issues with doing their daily activities that's actually impacting on their life. And a lot of my patients do actually stress that they got no one to go for. They don't know where to go because the doctors will be like, go home and do some exercise, but they're like, what and exactly specific, or what do you do to actually recover? So I'm myself here tend to just help out a lot of female patients to get them go through a lot of things.
Just going on Caroline's point, and I think a lot of female patients are really quite embarrassed to bring up these issues, and a lot of female patients that we see actually don't understand the implication of what those symptoms, for example, things like stress incontinence, or even the sensation of prolapse means, and how much it contributes to their back pain. So sometimes we have to open up that conversation with them in order to guide them to the right path. And I think that group of patient gets overlooked a lot of the times.
And with female as well, a lot of education and advice is actually one important part of the treatment approach in the whole, because in the first place they have to understand what pelvic floor muscles are and what the functions are, and then they can actually go home and start to exercise. It's sometimes just a matter of if you do it, it's not about how often you do it and how much you do it. It's just because they don't actually know that something is actually exists there. So this is very important for them to understand.
I think you can have a few things to add to in terms of patients misunderstanding what it means by core strength in the gym as well.
Yeah.
And usually the core is it's a very common term that a lot of the gym goers use.
It gets thrown around a lot for business purposes.
It is. Train your core for lower back pain. But look, cores, to be honest, I don't even know what core actually refers to, okay? It just basically refers to, let's say, the abdominal muscles, I'm assuming. But usually it's not the abdominals that would actually help with lower back pain. In fact, they can actually make the pain worse in a way. Because overactive abdominals can actually put a lot of stress on that lower back muscles. And it's usually the deeper muscles that we need to train. And usually those deeper muscles are very difficult to train because you do have to continuously give feedbacks. And there are... I mean, unless you specialize in that area, it's very difficult to actually know that you're activating those muscles. And usually those stabilizers need to be activated before a heavy squat or before a heavy deadlift or anything, any strenuous movement there.
And it's interesting to see how many patients come into our clinic, and when we tell them you're not activating your core right, they start showing me their six packs. So it does happen. But having strength and having good control is two separate things. And going back to Leo and what Carl was talking about, in terms of deeper muscle layer and also recovered for the core, the concept of core is not holding everything rigid. It's about having good control. So when we think about core, the most common misconception is all about the front, but whereas core stability is the coordination of rhythm between muscles like diaphragm, your deeper back extensor called lumbar multifidus, your transverse abdominis, and also your pelvic floor. So it's not about how strong and how much, how good your six-pack look. It's about how well your body can control and coordinate these aspects of your body.
And I also see a lot of patients who are actually Pilates instructors and personal trainers who develop a lot of back pain. It's because after assessment, actually having a real conversation with them, they actually express that they've been told to actually tense up the core while they're actually doing and actually taking the class, whereas that's not what they actually meant to do. So people have to be well educated enough to actually know what they should do and should not do, and then just have a judgment based on that later.
So I guess if you look at our body injury in general on a spectrum, you have the really light end where, I'll suck it up, I'll rest it, it'll go away. There's that too. We understand that. But there was also on the other end of the scale where if you ignore it, it starts to get worse and worse and worse. As a rule of thumb, and again, this is not definite, but as a rule of thumb, usually if you have injury, after the initial inflammation response, which is our body's response to heal and recover, that response most of the time lasts from 48 to 72 hours. So if your symptom goes past that length of time, usually it is a clear sign saying you need some help.
And if you get a frequent acute lower back, that's also a good sign to seek medical assistance as well. For example, I've had a patient who initially had a flare-up of a lower back pain, they couldn't get up, had to lie in bed. That happened once a year. The following year, they started having it twice a year. The year after, they started having it 4 or 5 times a year. So if that frequency of that acute lower back pain increases, you're definitely doing something wrong to it, and that's also a good indicator for you to come and seek help.
And also, I think prevention is always better than treatment in treating back conditions because it's quite a complex issue. You really don't want to wait until the last day where I can't move and then I'm going to seek help. People really have to actually be more proactive and take care of themselves.
I think that's especially more important in the population that you see. Women, when they're going through pregnancy, sometimes seeking treatment early instead of only seeking treatment when the pain starts to come up. And that's a lot more efficient, isn't it?
Definitely.